And a stroke is one of the leading causes of death in America, claiming one life every 4 minutes.
Yeah, and according to the Centers for Disease Control, nearly 25% of strokes are actually happening in people under the age of 65. Roland Rodriguez joins us live from Doctors Regional Hospital. And Roland, we're not just talking about adults here, are we?
Good morning, guys, and good morning, South Texas. No, we are not. Matter of fact, it seems pretty unthinkable that, I guess you could say that children can have strokes. Well, the answer is yes, they can.
I understand that you fall up the stairs.
A stroke, which blocks blood flow or causes bleeding in the brain, can happen at any age. It's a myth that only older adults have strokes. Stroke can happen to teenagers, children, newborns, and unborn babies.
The kids can have sequelae, which include delay of learning. They can have residual seizures, or they can have mental impairments due to the strokes. But most of the kids, because the brain is growing, they tend to do okay.
The risk of stroke in children is 11 in 100,000 per year. In some cases, the cause is sickle cell disease, immune disorders, or a heart defect.
And then we need to address the correct pathology that is causing this. If it is a sickle cell disease, we transfuse these kids. If it is a coagulation problem, inherited coagulation problem, we have to give blood thinners. And most of the time, we have to give antiplatelets like aspirin for life to keep them with the blood thin.
Although strokes in kids aren't common, parents are advised to recognize signs of stroke and know the risk factors for all ages.
Signs and symptoms on a young kid can present differently from an adult. They can have extreme sleepiness, they can be very somnolent, not waking up. They have the tendency to use only one side of the body, and as a result they walk lateralizing to one side, or they just fall. Another symptom could be severe headaches, vomiting, sleepiness, dizziness, and as I mentioned, the loss of balance and coordination.
While stroke in children can be devastating, children have a better ability to heal than an adult.
As a young kid, you have a very high chance to recover completely if you get the treatment on time, and also if you get the therapy that you need, because the brain of the children are just developing and have a higher chance to recover.
And if you'd like more information on children and strokes, all you have to do is visit our website at kristv.com.